Okay, so today we're going to be changing a central line. This will be the dressing change. We've gathered our supplies. We have our central line kit. We have our caps. We have 3 saline flushes and a vial of heparin that's 100 units per mil, and also some alcohol swabs. So we're going to follow the policy and start with performing hand hygiene with our alcohol foam. We're going to explain the procedure to our patient, tell them what to expect, and ask them to turn their head away so they're not breathing at the site. We will put on a yellow isolation gown, and then we're ready to start with the dressing. We have a garbage can positioned near the bed, so it's easy to discard the items we've used. We open the package, keeping everything sterile. We remove the first mask. And then remove the first set of the gloves. These are sterile gloves. Okay, and this first set of sterile gloves is used to remove the old dressing. If you need to secure the catheter with one hand, you can. Always pull away from the catheter so you don't pull it out when you're removing the tegaderm. It should come off quite easily. You can see the patient is turned away so they're not breathing on the site. Okay. You can discard that dressing and remove those gloves. And again, perform hand hygiene with the alcohol foam. Okay. Continue to open the dressing kit. And in there you'll find another set of sterile gloves. And proceed by putting those sterile gloves on. Inside that kit you'll find a tegaderm dressing and a ChloraPrep. You can remove the ChloraPrep and give the applicator a squeeze, holding it down so the solution hits the foam sponge. And you can rub vigorously around the insertion site. And cover the full area where the dressing will be applied. Allow the ChloraPrep to dry. And then you can place the tegaderm on the site, allowing a 2-inch border around the insertion site to the edges of the tegaderm. With every dressing change, we do change the caps. And so I've assembled my saline flushes and some heparin to flush the ports when we're finished. We'll start by cleaning around the site. of the hub and the cap. So vigorously scrub around the site. Make sure your clamp is on. Prepare your cap. By priming it with some saline until all of the air is removed. Leave the syringe attached. Remove the cap from this cap. And then with this clamped again, twist off the cap and replace with the new one. Once your connections are tight, you can open the clamp and flush it with 10 mils of normal saline. And then you heparinize the port with 1 mil of 100 units of heparin. Making sure that we're only giving 1 mil here. And then we reclamp. Okay, so then we'll continue and proceed to the next 2 caps. Again, we take the cap and prime it with normal saline. And scrub the connection vigorously for 7 seconds with an alcohol swab. Remove, or make sure that this is clamped. Remove the cap. Replace it with a new cap. We unclamp the line, flush it with 10 mils of normal saline. And then again we take our heparin, 100 units per mil, and heparinize the line with 1 mil. Remove the heparin syringe and reapply the clamp if the line is not in use. Okay. We'll continue to the last cap. Again, we'll prime that cap to remove the air with the normal saline. We'll scrub the connection site 7 seconds with an alcohol swab. Make sure that the line is securely clamped. Remove the old cap. Replace it with a new one. Open the clamp and flush with 10 mils of normal saline. Again, we'll heparinize this one with 100 units of heparin, U100 per mil. And then again, if the line's not in use, we'll apply the clamp. Ensure that it's securely taped. The tegaderm is on. If you need to, you can apply tape below. These dressing changes are done every 7 days or as needed. And upon the completion of the dressing change, you would be required to chart it in the EPIC system.